Hi, everyone, and welcome to today's webinar, Understanding Healthcare in Retirement, Medicare 101. Before we officially get started, I just want to go over some general housekeeping items, and they're pretty basic. But if anyone has any questions, well, we did ask for you to ask any questions during registration. Those will be answered during the presentation or at the end of the presentation if time permits. If your question was not answered, we will have a team member reach out to you so they can get that question answered. We aren't using the chat or the questions function for this webinar as we can't take live questions. But again, if you have any questions, please reach out to our speakers or we will happily reach out to you after the webinar. Unfortunately, we are not able to provide a copy of the slides or an on-demand recording right after the webinar, but we do hope to send a on-demand recording after that recording gets approved by our compliance reviewer. More information about our offered services and more information about Mueller Financial Services is available in the handout section. Again, a handout section will not include the slides, but just more general information about the company. Also, if you haven't heard, we have a new podcast called Managing Your Wealth, Your Vision, Our Guidance, which is available to listen anywhere you listen to podcasts. So topics about that include anything from investments to retirement planning, etc. And with that, I just want to hand things over to our host, Brennan Hollenbeck, who's one of our wealth advisors here at Mueller Financial, to talk more about the company and our featured speakers today.
Thank you so much, Emily. Really appreciate it. For those that are not familiar with Mueller Financial, we are an independent advisory firm. We've served clients for over 30 years. We're headquartered here in the Chicagoland area with 4 offices around Chicago, another in Sarasota, Florida. We've expanded through the regional and national level through several growth and acquisitions, and we offer a broad range of services for everybody from corporations to business owners, executives, independent professionals, high net worth individuals, and their families. We really enjoy going through an educational process with our clients, and our deep investment strategies and our team of professionals here are really what we pride ourselves on. We like to enter into a partnership with our clients so that we can best guide them on their financial needs and make sure that all their insurance planning is covered as well, which we also consult on things like today's topic of Medicare coverage. So we're really excited to host this webinar for you all. We think it's going to be extremely educational. As Emily mentioned, we encourage everyone to ask questions throughout this. We'll address them at the end. And if something wasn't answered, please do feel free to reach out to one of our Mueller Financial specialists. So with that, I'd like to introduce our 2 key speakers today. With us, we have Rick Roberts from Producers XL. Rick is the Producer XL's resident Medicare supplement, Medicare Advantage, and Part D expert. He's been in the industry for nearly 25 years, and with Producers XL the last 6 since 2016. He's going to be able to assist and answer all of our questions when it comes to the product itself, anything about open enrollment, and he also can help obviously expand your general knowledge on Medicare. As well, joining us, and some of you on this call may know him, but we have Curtis Wiedemann, who up until last year when he retired from Mueller Financial Services, Curtis is still serving as a general agent. And for those that have worked with Curtis, you know that he has a very deep knowledge of the insurance and risk management space and specializing in Medicare. So he's going to be speaking alongside Rick for some additional comments, and also will be able to help answer any questions you might have. With that, we appreciate your time, and I'm going to turn it over to Rick for the presentation.
Well, good afternoon, and thank you, everybody, and thank you, Mueller Financial, for having me on here. Can you see my screen okay? I just want to double check. Okay.
We can, yes, Rick.
All right. I want to welcome everybody. Retirement is, health insurance and retirements can be very confusing. And so what I'm going to cover this afternoon is the basics of Medicare, because as you age into Medicare, we know that it can be very confusing. And so what I'm going to cover today is just going to give you the basics of what Medicare is, what you can expect, some of the enrollment timelines and other things like that. So it's just going to give you a basic overall knowledge of exactly what to expect as you age in to age 65 into Medicare. So what is Medicare? Medicare is a federally health insurance program for individuals 65 and older and for those under age 65 due to disability. It's managed by the Centers of Medicare and Medicaid Services. And here's a fun little fact for you. Did you know the first person enrolled into Medicare was former President Harry S. Truman back in 1965? Fun little fact. So Medicare basics, what is Medicare? Again, it's health insurance for individuals age 65 and older, under age 65 with certain disabilities, including end-stage renal disease, because individuals that are on disability past 24 months can qualify for Medicare benefits. So what government agencies are responsible for helping you with Medicare? This is where it gets a little bit confusing. You got Social Security Administration can help you. If you're an individual that's looking to start collecting their Social Security income, we highly recommend reaching out to the Social Security agent when dealing with those things. But in terms of Medicare, the Social Security agency can help you with that. They also collect premiums for Part B, Part A if you have to pay it, and we'll get into that a little bit later. The Centers for Medicare and Medicaid Services, CMS, is another agency that helps in terms of Medicare and Medicaid. A lot of information can be obtained through Medicare.gov. It's a great website for individuals that are looking to understand a little bit more of Medicare. A lot of the information I'm providing this afternoon actually comes from Medicare.gov. And then CMS is administered, also administers the Medicare program. Now moving into the basics of Medicare, there's 4 parts to Medicare. There's Part A, which is the hospital insurance. Part B of Medicare is dealing with the medical insurance, like your doctor's office visits, labs, x-rays, things of that nature. Part C, you may have heard of the Medicare Advantage plans. That is Part C. That is an option that we'll discuss a little bit further, that you can go through a private insurance company and get your Medicare needs provided that way. Then you have Part D plans, the PDP plans, which is the prescription drug plans. That started back in 2006. This is something that they realized they needed to provide their Medicare beneficiaries. They found out that a lot of Medicare beneficiaries were not getting the medications they needed, did not have the money to do it, and so they were cutting expenses in other places. And so they came out with the Part D plans again back in 2006 to help with that. So to dig a little bit deeper into Medicare Part A, which is the hospital insurance, this is what covers inpatient care in hospitals, your skilled nursing facility care, hospice care, and home health care. So Medicare Part A coverage, hospital stays, and this is all the information for 2022. The 2023 information will come out probably mid to late December. So what I have here to provide is for the 2022 information. But Medicare Part A, again, which is the hospital insurance, believe it or not, has a deductible. So you go spend one day in the hospital, you're going to have a $1,556 Part A deductible that you have to pay. As you can see, days 61 through 90, there's a $389 per day copayment. Days 91 through 150, it jumps up to $778 per day. Anything over $151 days is 100% cost upon the beneficiary. So one of the questions we had, why would you want to buy a Medicare supplement policy when on Medicare? And this is a good example why you would want to pick up a Medicare supplement policy, because the Medicare supplement policy, which is also called a Medigap plan, covers these deductibles and copays. So for instance, the Medicare supplement plan would come in and pick up that $1,556 of that Part A deductible. And those daily copays that you see for days 61 through 90 and 90 through 150 would be picked up by that Medicare supplement. Another thing to remember when looking at Medicare Part A, that deductible of $1,556 is not a one-time per year deductible. It's considered, if you go to the hospital for one day, you come out after one day, you have 60 consecutive days for that benefit to be included for your hospital stay. Beyond that 60 days, they can reset that. And so if you would have to go back into the hospital, let's say the 61st day, you would be charged another $1,556 for that Part A deductible. So that is something to remember, is you can hit that deductible more than once in a year. And so that really emphasizes the need to get some sort of a Medicare supplement plan to help cover that deductible. So Medicare Part A coverage also covers skilled nursing care. So in 2022, you can expect to pay nothing for the first 20 days. Days 20 through 100, you pay up to $194.50 per day copayment, and anything over 100 days is 100% on the beneficiary. So this is another thing where your Medicare supplement would help cover those copays. Days 21 through 100, the $194.50 would help cover those copayments. So we had another question on there in terms of what was it? Looking at extended care. And so Medicare doesn't really pay in terms of a long-term care situation, but for skilled nursing care, and to qualify for skilled nursing care, an individual has to be admitted into the hospital for 3 consecutive days and then discharged into a skilled nursing facility. And this coverage would be provided for you. Just going into a nursing home or a skilled nursing facility, that is just a different situation where Medicare is not going to cover those expenses. A little bit more on the skilled nursing facility. So Medicare covers only short-term skilled nursing home care with no payments after 100 days. And as you saw, the first 20 is covered, 20 through 100, there's that copayment charge. But again, you have those certain qualifications to get into those skilled nursing facility and have Medicare pay for that. If you're not admitted into the hospital for 3 consecutive days, Medicare is not going to pay anything towards that.
So Rick, a
yes.
question that comes up on this, where people nowadays are getting knee replacements, hip replacements, things like that, that are done as outpatient, and where they're maybe live alone, they're being sent to a rehab facility. So would that qualify in this case, where they don't have a 3-day hospital stay?
That is a tough one. That's on a individual basis. Medicare doesn't have anything out there that gives us the specifics on that. A lot of times they will help cover a lot of those costs, the physical therapy part of it. As you would say, it'd be more so that than the skilled nursing care, because you're not going into a facility, but maybe you're at home and then you're going out for some physical therapy. Correct.
So in this case, it would be considered more rehab than it would be considered skilled care.
Correct.
Okay. And that's the questions that I get too. Thank you.
Yep. And that's a really good question. It's one of those that you wish Medicare would cover a little bit more on that, but it gets more into the side of it, of the rehabilitation part of it when it comes to that. So all in all, what does Medicare cover for long-term care and facility care like that? And these days, maybe 10% of, that cost is going to be covered by Medicare if you qualify for it. Otherwise, it really shows the need for an individual to look at a long-term care policy. So a little bit on home health care that's covered under Medicare. Medicare pays benefits for home health care only if you need part-time skilled nursing care. Here you go, physical therapy and speech therapy. You're confined to your home. Your doctor prescribes home health care and sets up a care program. And that home health care agency, and this is very key, they have to be Medicare approved. for that home care. Now moving on to Part B of Medicare. Again, this is the medical insurance. This is, this covers, doctor's office visits, other healthcare providers, your outpatient care, home health care, durable medical equipment like wheelchairs, walkers, your beds, oxygen would be under durable medical equipment. Many of the preventative services like screening shots, vaccines, wellness visits, that's all going to be covered under Part B of Medicare. And Part B of Medicare also has a deductible, which is $233 here for 2022. And the other thing with the Part B of Medicare is, Medicare covers 80% of Part B charges. Anything that's Medicare approved on the Part B side, they will pay 80%. So that leaves 20% that is on the beneficiary to pay. So it shows another need for some sort of coverage to come in, like a Medicare supplement plan, to cover, in some cases, depending on eligibility for Medicare, but you can get the Part B deductible paid for. And most important is that 20% that Medicare does not pay can be covered by the Medicare supplement. So this is just some examples of Part B coverage of services and supplies that are usually covered. Hospitals, services received in hospitals, doctor's office visits, approved, care within an approved medical or nursing facility, at home, diagnostics, again, testing, labs, x-rays, emergency room, things of that nature. And I'm not going to go through every single one of these, because I think what's really important, not so much what is covered by Medicare, but this next slide is what is not usually covered by Medicare. So what is not usually covered by Medicare is your dental care, a routine physical examination. And you're probably wondering, well, why is not a routine physical examination not covered by Medicare? Well, you have your wellness check that Medicare pays for every year. And that's just questions that the doctor is going to ask you. But when it comes to your labs and x-rays and different things like that, especially your labs, your blood work and things like that, technically that is not covered by Medicare unless there's an underlying health condition that they can use to bill Medicare and get those things covered. So in technicality, the routine physical examinations are not covered. Oral surgery is not covered. A routine foot care, eye and ear examinations are not covered. Some immunizations will not be covered. Chiropractic services, except for manual manipulation of the spine. And looking at the hospital outpatient services, cosmetic procedures not medically necessary are not going to be covered. Lab tests not medically necessary. And, the main thing to remember is if Medicare doesn't approve the charge, and you're looking at a Medicare supplement, the supplement's not going to pick that up either if it's not a Medicare approved charge. So between Medicare and a supplement, a lot of the things that you see on your screen is not going to be covered. What other services? Again, dental plates, orthopedic shoes, first aid supplies, eyeglasses, hearing aids. And so, as you know, if Medicare is not going to cover your dental, your vision, or your hearing, then that's going to be another service that you may be looking to get a policy for to cover those needs, since Medicare and your Medicare supplements will not cover those.
Yeah, and Rick, one of the things that I've had a number of clients get caught off guard on was the immunizations, in that Medicare Part B covers virtually all of the immunizations, the flu shots, the COVID and everything. The one that they haven't up to this point is the shingles shot.
That is correct. Yep.
So people then go to get their shingles shots once they go on Medicare and find out it's $150, $200. So a lot of times what I've recommended is, if people are getting, getting up to Medicare age, to make sure that they get their shingles shots before they drop off their group coverage. Or the other issue now, from my understanding, is that under the new tax law, the shingles shots now are going to be included starting next year. So either get it before or probably wait until next year. to
Yeah,
prevent having
because
to
that
pay
makes
for it.
sense, because I think they recommend that at age 50, if I remember
Right.
right, for the single
Hmm.
shot. So plenty of time before getting on Medicare to have that opportunity. But like you said, that should be changing next year
Hmm.
to get that included. Otherwise, I mean, that's quite a pretty good sum of $150, $200 for that shot. And I think it takes 2 shots, if I remember right.
It does, yes.
Yes. So, and that's what this is for, to give everybody an idea exactly what to expect. So a little bit of less of a surprise when it comes time to turning 65 and making that step into Medicare. So let's move on to Medicare, how to enroll into Medicare. It all depends upon your age, depends on, what other type of health insurance do you have? Are you currently working? Are you going to be able to continue to work and collect those health benefits from your employer? Do you have end-stage renal disease? Another question is, do you get Social Security disability? You get Social Security retirement benefits? Or even railroad retirement benefits will all be a factor in terms of enrolling into Medicare. Enrolling in on time is very, very important. I'm going to hit on this a few times this afternoon. It's very important to make sure you know what your windows are to enroll into Medicare and to enroll into, if you choose a Medicare supplement, there's an enrollment window there too. But it's very important to make sure that you enroll on time, that you don't have any gaps in coverage and things like that. So if you don't enroll on time, obviously you're going to have a higher cost, maybe a late enrollment penalty, because people that should have Medicare Part A and B, most people get Medicare Part A for free. If they work 10 years, 40 quarters and paid in their Medicare taxes, most people get that for free, but there is a premium to Part B of Medicare. And if you qualify for Medicare and you should have it and you don't get it, there's penalties, and we'll cover that a little bit later too. There's penalties that CMS has enacted for Medicare, to try to get people to enroll when they should. Coverage might be affected in terms of gaps of coverage, waiting periods for pre-existing conditions for Medicare supplements. And what that comes down to, there's certain periods of time you can enroll into Medicare, you can enroll into a Medicare supplement where you don't have to answer any health questions. So if you have any health issues, you really, really got to pay attention to make sure you enroll in these things on time, or otherwise you have to go through underwriting and you may not qualify. So you may not be able to buy those Medicare supplement plans if you have health issues and you're outside of some of a sort of an open enrollment or guaranteed issue situation. If on employer health insurance, it can impact your dependent choices. We see this quite often where you have an individual that may be a year or two or even older than their spouse and they're retiring, but then, if they retire and they lose that coverage, then all of a sudden their spouse or they don't have insurance. And so that's why you see a lot of people work past 65, is just because they have those dependents and spouses where they need to provide that coverage. So when is enrollment automatic? If you are already receiving Social Security or railroad retirement benefits, at least 4 months before turning age 65, you will automatically get enrolled. They will mail out a packet to you about 3 months before you turn 65. If on disability, on that 25th month of disability, they're going to send you information. And that's one of the things that makes Medicare so confusing, because as people age and get, 64, 65, they get a lot of things in the mail, not just from Medicare, but from agents, advisors. They see a lot of things on TV and they get so much information that you get confused with what's going on. And so that's just one of the main points today is, so you have a better understanding of what's going on and what to expect. But, it'll include your Medicare card. If you don't want Part B of Medicare and you're automatically enrolled into A and B, you can sign that card, send that back in, and they will remove Part B. There's situations why you may not want to have Part B of Medicare, and that would be is a situation where you're continuing to work and are going to be on group insurance past age 65. And, one of the questions that we had on registration: should owners of corporations, non-W-2s who are highly compensated, enroll in Medicare when they are still working beyond age 65? And again, it's not so much about income or anything like that. It's about the enrollment windows that you have for Medicare. Also the group size. If you work for a business that has less than 20 people on their health plan, that's considered a small employer, and Medicare becomes primary, and the secondary insurance is the group coverage. So in situations like that, it's highly recommended to get A and B. Whenever Medicare is going to be primary, you want to make sure you have A and B. Now there's situations about like HSA accounts, contributions to that. I mean, those are factors that you have to think about. If you want to contribute to an HSA, you don't want to enroll into Medicare yet, because once you do, you have to halt those HSA contributions. And so different things like that. And then delaying, for individuals that maybe they work for a group that's beyond 20 employees, they can delay that Part B of Medicare until they actually come off that group insurance. Maybe that's at age 67. And at that time, they can do a delayed Part B enrollment, get into Part B, and then it's still considered their open enrollment into like a Medicare supplement plan. But what you have initially done is you've cut out an expense of that Part B premium that you have to pay for at least 2 years. And I'll show you a chart, but the minimum Part B premium for 2022 is 170.10 a month. So if you're able to continue to work past age 65 and not paying that Part B premium, that's a benefit of saving some money there also. So when is enrollment not automatic? And I got to say, probably about 90% of the people we work with, it's not automatic. They're not collecting some sort of Social Security benefit at age 65 or the 4 months before. So you have to be proactive on enrolling in Medicare Part A and B. Even if you're eligible for Part A, it's highly recommended to get it. Excluding certain events, in terms of, or situations, I should say, like a HSA and different things like that, because enrolling into Part A and wanting to contribute to a health savings account, again, there's some conflicts there that you want to address. But you should contact Social Security to apply for Medicare 3 months before you turn 65. And I'm going to emphasize the 3 months before, because it takes a little bit for Medicare to get those cards out to the beneficiaries. And to enroll into, for instance, a Part D plan, you have to have that Medicare number to do that. Medicare supplements we can put on the application, applied for and things like that, but you got to know you have to enroll into Medicare within those first 3 months. Makes it so much easier, and I'll cover that a little bit more. You do not have to be retired to get Medicare. Again, under age 65, you can get Medicare due to disability, and that is available after 24 months on disability. So it's not just for people turning 65. So where do you enroll for Medicare? I can tell you right now, a lot of our agents utilize the ssa.gov. You can go through and you can do everything online. You can still make an appointment with the local Social Security office. And I got to say, over the last few years with COVID, that was not really an option. You can also call the 800 number to enroll, and it's highly recommended, if you're going to be taking Social Security benefits, income benefits, that you schedule that appointment with your local Social Security office, because as you know, there's a lot of options on that side of it too, which I don't want to get into. But in terms of the 3 ways to do it, you can do it online, you can schedule a face-to-face appointment with the local Social Security office, or you can call an 800 number, 1-800-MEDICARE, to enroll. So here, what we have here is, some of the key Medicare enrollment periods. And so when you're approaching age 65, you're coming within your initial enrollment period. And what that is the 3 months before your 65th birthday, the month of, and then 3 months after is your initial 7-month enrollment period into Medicare itself. And what you really want to focus on, again, due to the need of having that Medicare number and making sure you have other coverage in place so you don't have any gaps in coverage, and to make sure that you can get into it like a supplement plan without having to go through underwriting, you want to make sure that you fall within the first 3 months. So, when you're 64, you really got to be thinking about this and remembering, that, yeah, I need to enroll into Medicare those 3 months before I turn 65. It's very crucial. It makes things go a lot smoother if you focus on those first 3 months. If a situation arises where you're not able to enroll in those 7 months, maybe you forgot or something like that, there is another opportunity. It's called the general election period. And this is a period from January 1st to March 31st that individuals can enroll into Medicare, but the effective date of that Medicare is not going to be until July 1st. Why they do that, I'm not for sure, but it does give you another enrollment window if you miss your initial 7-month window to enroll into Medicare. But that delay in that start date can give you some delays in obviously the coverage that you need. You're going to have some gaps in coverage. So it reemphasizes the need to make sure you enroll within at least those first 7 months, but most importantly, those first 3 months before you turn 65. So looking at another open enrollment period, and this is what we're coming up on here, is the annual election period, AEP. You might be seeing some commercials about this already, but this is a period of time that starts October 15th through December 7th. And it's nothing to do about in terms of enrolling into Medicare, but it's dealing with enrolling into a Medicare Advantage plan or a prescription drug plan. I will cover in a little bit further down, what is a Medicare Advantage plan, but in a sense, what it is you have an option to get your Medicare benefits taken care of through Medicare, or you can go to a private insurance company. So the open enrollment period is a very busy time. It's where individuals that have Medicare Advantage plans, they can switch to another one. They can choose to go back to original Medicare and pick up a Medicare supplement plan if they choose to, and they qualify health-wise to do that. And it's the same thing on the Part D plan, which is the prescription drug plan. It's highly recommended every year that individuals go through and requote their drug plan, because the prices change, the pharmacies that are preferred and standard change, the formularies of those drug plans change every year. And it's highly recommended that individuals go in there and check their Part D quotes to see if they need to move from one plan to another to be beneficial for them. So again, that's the annual election period, which is October 15th through December 7th. Anyone that enrolls or makes changes during that period of time, the coverage changes start January 1st. This is something that still deals with the state of Illinois, and they have effective January 1st of this year, individuals that are age 65 through 75 have a open enrollment period based upon their birthday. So if your individual birthday from that point on to 45 days, you have the ability to switch Medicare supplement plans. So the individual may purchase any Medicare supplement plan with the same company or insurer that they offer benefits equal to or lesser than those provided by the previous coverage. So it gives you the ability to sort of look and see. Sometimes you may be put into a Medicare supplement plan that you've had for a number of years, and let's say it's a big company out there and they came out with a new book of business that the premiums are a little bit cheaper. Well, if you stay within that company, which is what you're required to do, you can shop that plan to see if you can get a little bit cheaper premium, and it just gives you that little flexibility every year to see if you can get a little bit better pricing on your Medicare supplement plan. So I came across this and want to make sure you guys knew about this. So the Medicare enrollment periods, we talked a little bit about that. You have an 8-month period when you can enroll into Medicare Part A and B, and that's coming off of your group health plan. So if you're coming off that group health plan, you can, you don't have to get a or B, unless, you know, there's certain qualifications, you know, less than 20 employees, Medicare's primary, then you should have A and B. Otherwise, if it's a larger group, you can delay that. You can delay that up to 8 months after you come off that group health insurance. But again, it's highly recommended if you can, especially get Part A. Again, most people have paid in their Medicare taxes for the last 10 years, 40 quarters, get that for free. And then the Part B, again, it depends on your situation. If you want to get that right away when you turn 65, or do you want to delay that because you're on group insurance and you work for a group that's bigger than 20 employees on that plan. So again, it's not just cut and dry. It just depends on the individual situation on which way you should look at it. If you enroll into original Medicare during a special enrollment period, you can also join Medicare Part C, which is a Medicare Advantage plan, or you can pick up a supplement plan. So when you, let's look at the scenario of turning 65, you're getting A and B, you want to get a Medicare supplement plan, you got to have A and B. If you want to get a Medicare Advantage plan, you still have to get Medicare A and B, even though that you're going to enroll into a Medicare Advantage plan, and I'll go into a little more details of those. You have 6-month period from the Part B effective date to buy a Medicare supplement plan or a Medigap plan without medical underwriting. So that's one of those key things to remember. If you're coming off of, you know, a group plan, let's say you work till 67, that Part B effective date is, you know, fresh, new. You got 6 months from that Part B effective date to get into a Medicare supplement plan without having to go through underwriting. And again, you really got to pay attention that if you have any health concerns or anything like that, you want to make sure you get in on those open enrollment situations where you don't have to go through underwriting. That way you don't have to worry about being declined. So we're going to look back a little bit on Part A and just in terms of the penalties that you can occur with Medicare if you don't enroll into these different levels of Medicare A, B, and D. So with Medicare Part A, again, most people get Medicare Part A for free because they worked the 10 years, 40 quarters, paid in their Medicare taxes. But if you do not qualify for premium-free Part A, and let's say you turn 65 and you didn't sign up for Medicare Part A in a timely manner within that window, you can start getting a 10% penalty based upon what that Part A premium is. And let's say you had that penalty for, let's say you went 2 years where you should have had Medicare Part A, but you didn't. You know what? You're going to end up with 4 years of that penalty. Then after 4 years, it'll drop off. But whatever you go with, maybe you just, you know, you should have had it for 3 months and you didn't, or you're going to end up with the 6-month penalty on Part A. Again, we don't see this very often because most people get penalty. There's no penalties because they get Medicare Part A for free. Now looking at Part B penalty, this is something that we see a little bit more often. You get up to a 10% penalty for each year that you neglect to sign up. So if you turn 65 and you know you didn't sign up for Medicare and you should have, so for each year you go without having Part B, they can give you a 10% penalty. And it's 10% based upon what that Part B premium is. That, you know, and that can be based upon your income that we'll get to in a little bit. But that penalty does not disappear. So that penalty, if you get a penalty for, you know, not enrolling in Medicare Part B on time, then that's going to stick with you for the rest of your life. And that gets us into the Part D penalties. And I know it's a lot of information in terms of these penalties, but it's very crucial for you guys to know exactly, again, when to enroll, to make sure you enroll when you're first qualified for it based on your individual situations. So Part D penalty is another one of those that they'll, if you don't have a Part D plan, you know, or some sort of other credible coverage. So if you're an individual that's staying on and working past 65, you're on your group insurance, most likely your group insurance has a credible prescription drug plan. And they're required to let you know if their plan is credible or not. You know, another credible plan is VA benefits. VA drug benefits is considered a credible plan. So If you're using that, then you don't have to sign up for an individual Part D plan if you don't want to, because the VA drug benefits is considered credible. But what they will do is they'll look at each month that you go without Part D, a credible Part D coverage. For each month, it's a 1% penalty based upon the national average. So in cents, 33 cents a month is what you can build up for a Part D premium penalty. And we've had clients where they've went 3, 4, 5 years without getting a Part D plan because they never took any medications. And so if they get a Part D penalty like that, it sticks with them for the rest of their life. So one of the things that's always recommended is even if you're not taking medications, you should go out there and get, pretty much the cheapest Part D plan that you can get. You can get one for $6 or $7 a month, just so you're not incurring that penalty down the road. So it's very important. So we covered the Part A, Part B, and a Part D penalties. Again, this is just one of the ways that the government wants to make sure you participate in these plans. They got to have money coming into these plans to be able to, send money out in terms of benefits and things like that. So we're going to go into Medicare coverage options. So again, your Part A is your hospital insurance administered by the federal government. Again, it covers hospital stays, skilled nursing facilities, home health care, hospice. In general, most people do not pay a monthly premium for this coverage. Part A does include deductibles and copay charges, as we discussed, and that shows the importance of having some sort of a Medigap or Medicare supplement policy to help cover those gaps. Part B, again, is the insurance dealing with medical offices, doctor's offices, supplies, labs, x-rays, durable medical equipment, diabetic supplies is under Part B, home health care, a lot of the preventative services. The standard monthly premium for Part B is $170.10, and that's all. It can be higher and lower based on income, and I'll show you that. Part B does include deductibles and coinsurance. Again, it has, Part B deductible of $233, and the coinsurance, Medicare pays 80%. The beneficiary pays the remaining 20%. So paying for Part B is usually deducted. You can have it deducted. If you're collecting Social Security benefits, it'll be deducted out of Social Security income or the railroad retirement or federal retirement benefits. Most people, when they turn 65, maybe they want to put off collecting Social Security for a few years. And so what they initially do is they bill you every 3 months, a direct bill. Once you receive your first bill for Medicare Part B, you can reach out to them and you can set that up on a monthly bank draft if you want. But initial billing for your Medicare Part B comes as a direct bill every 3 months. So here's a chart I was hinting to earlier, and this is the Part B premium chart, and this is all based upon income levels. So if you're looking at joint income that's less than or equal to $182,000, that's where your monthly premium for Part B is $170.10. It goes all the way up for incomes greater than or equal to $750,000 for joint. You can pay up to $578.30 for Part B. So depending on where you land in these income thresholds, this is what you can expect to pay for Part B of Medicare. So let's go into Medicare Advantage plans. We haven't talked very much about that. And what that is again, you have the ability to go out there, you have to get Medicare A and B. Do you want to go to the doctor and have them bill Medicare, or are you interested in going to a private insurance company that you'll contract with, and they will provide all the Medicare benefits and take care of those things with the doctor's offices and hospitals and stuff? So that's what, since that's what that is, Medicare gives you the ability to choose. Do you want Medicare to take care of it, or do you want a private insurance company to take care of it? That's what your Medicare Advantage plan is, offered by private insurance companies that are approved by Medicare to provide Medicare coverage A and B. Sometimes prescription drug plans, the Part D plans, are included in these Medicare Advantage policies. In most of these plans, you need to use a network like an HMO or PPO, but they are network driven. Medicare Advantage plans are network driven. And so you always got to make sure the doctors that you go to are also contracted with these Medicare Advantage plans for them to really work right. And then you got to live in an area that those plans are available for sale. Many of the Medicare Advantage plans will include additional benefits like dental and vision, which is really nice. They include deductibles and co-insurance, and individual max out-of-pockets. For instance, for 2022, the max out-of-pocket a Medicare Advantage plan can have is $7,550. So that's the worst case scenario. This is different coverage than Medicare supplements, and I'll go into that here soon. But you cannot have, I want to stress, you cannot have a Medicare supplement plan and a Medigap plan. One of the questions that was asked, is it a good idea to opt for Medicare Advantage plans? Do you recommend a provider? Well, again, I can't recommend a certain specific provider because it all depends upon you, the insured. Where you live, the doctors that you go to, are they in network, and then your medications, the medications that you take. Since a lot of these plans include a Part D plan, the prescription drug plan, the medications are part of the factor in determining which plan is best. So I can't give you specific information on that, but it's based upon the individual situation on which plan would be better versus another. The Part D, available for all people with Medicare. All you have to have to get a Part D plan is Medicare Part A. You got to have that Medicare number to apply for a Part D plan. They're also offered by private insurance companies like Medicare Advantage plans. Plan premiums, copays, and formularies, which is a list of covered drugs and deductibles, can vary greatly. And they can change every year. So that's why it's important on a Part D plan, a prescription drug plan, to get that quoted every single year. Can be offered as standalone or be included into a Medicare Advantage plan. Again, Medicare Advantage plans, a lot of them have them built into it. If you choose to go a Medicare supplement route, that's where you'll have a standalone drug plan to go with it. So a Part D enrollment is not year-round, is limited to certain enrollment dates. There's enrollment dates based upon, very similar to the dates to enroll into Medicare itself. Being new to Medicare, you have enrollment windows to enroll into a Part D plan. Same thing. AEP, we just talked about that. That's coming up as a time that you can enroll and switch plans. And then failure to enroll in Part D in the absence of credible coverage, as we just learned, you can result in late enrollment penalties. So similar to the Part B premiums, your Part D premiums are also affected by income levels. So anybody, look at joint filers under 182,000, there's no income adjustments related to the Part D plan, but as you get that income going higher, the very bottom there, income greater than 750,000, then you can have an additional monthly charge for your prescription drug plan of $77.90. So depending on where you fall within this chart, you can expect income related monthly adjustment to the Part D plan, just like the Part B of Medicare. Let's get into the Medicare supplement. We talked about that a little bit. Again, that is something that's offered by private insurance companies. You must have Medicare Part A and B to enroll into a Medicare supplement. Just like a Medicare Advantage plan, you have to have A and B. Helps pay for some of the health costs that original Medicare passes on to you. Hopefully you've paid attention when I was going through some of the deductibles and copays, because that's where your Medicare supplement really comes in handy, is to help cover those deductibles and those copays that original Medicare does not pay. The $1,556 Part A deductible covered by the supplement. The daily copays is going to be helped covered by the supplement. So it's very important to understand that. So Medicare will pay its share of Medicare approved amounts, and then your supplement will pay. That is very crucial right there. Before the supplement's going to pay for anything, Medicare has to pay for it, which means Medicare has to approve that charge. If Medicare doesn't approve that charge and Medicare doesn't pay for it, the supplement will not cover that either. So that's something to remember. The policy covers one person, accepted everywhere that Medicare accepted. Unlike Medicare Advantage plans that work inside networks like HMOs and PPOs, your Medicare supplements, you can go to any doctor that accepts Medicare, and they will bill that Medicare supplement plan. So it gives you a little more flexibility than a Medicare Advantage plan, especially for individuals that are traveling, that do a lot of traveling. Medicare supplement plan might be one of the ways that you want to look at for your health insurance needs at retirement. So you pay a monthly premium, and these plans are standardized by letters. Now I showed you, Part A, Part B, Part C, Part D of Medicare. Now we're going to go into the plans. Your Medicare supplements are plans. You got Plan A, Plan B, C, D, F, G, L, M, N, almost the entire alphabet. It gets a little confusing, but on your Medicare supplements, and I'm just going to use like Plan G is like one of the most common plans out there. It doesn't matter if you go to Humana, if you go to Aetna, if you go to Mutual of Omaha, CMS standardizes those plans. And so the only thing that's going to differ on those plans is maybe some of the extra benefits, but your premiums are going to differ. Depends on, how competitive those carriers want to be. But in terms of, what they're going to cover, in terms of the Medicare benefits, those are standardized. So it doesn't matter, again, if you're with one company over here or another company over there, a Plan G is a Plan G, a Plan F is a Plan F. And this just shows you a little bit on this chart of, the different plans, A, B, D, G, there's a high deductible G plan. Some of these are older plans. Usually what we work with right now is like a Plan G or a Plan N. And you can see the different check marks that just show you, which plans, what's covered under each plan. Now over here on the right-hand side, it says Medicare first eligible before 2020. For people that are aging into Medicare past January 1st of 2020, Plan C and F is not available to you. But for individuals that were Medicare eligible prior to January 1st of 2020, they can still get a Plan F. Maybe they have a Plan F Medicare supplement, and now they want to, they're looking to switch to another carrier to save some money. They can still get another Plan F, or they can make that jump to a Plan G. Plan G just usually is a little bit cheaper in terms of premium because right here they don't cover, Plan G does not cover Part B deductibles. Like the F did. F used to be considered the Cadillac of the Medicare supplement plans. And again, anyone new after January 1 of 2020, the older plans like this on C and F are not available anymore. But that just gives you a little breakdown of the different plans and, what benefits of Medicare, is covered. And as you can see, Plan G covers everything except for the Part B deductible. Which is that $233. So once you pay that $233 and it's a Medicare approved charge and Medicare covers its part of it, the supplement's going to cover up the rest. It's really nice to know, that your supplement's going to cover the gaps that you have in that original Medicare. So this just shows, again, the two options. You enroll into Medicare. Either case, you enroll into Medicare A and B. And then from that point on, you choose, do I want to go into a Medicare supplement insurance policy and pick up a prescription drug plan, or do I want to go to a private insurance company Medicare Advantage plan that will cover Medicare Parts A and B, and they're required to cover at least the minimum of what original Medicare covers. But they may include or may be able to add a prescription drug plan is also included there. But, if again, Medicare Advantage plans, they deal with choosing a network, or an HMO, PPO. And again, there's a little bit, more research you have to do in terms of, which is a better route for me, a Medicare supplement or a Medicare Advantage plan. I always give the example, let's say you go to the doctor and you have original Medicare and a Medicare supplement plan. So you go visit your doctor, you're going to give them a copy of your Medicare card, and you're going to give them a copy of your Medicare supplement card. Now, vice versa, if you go to a doctor's office and you have a Medicare Advantage plan, you only give them one card, and that card is the Medicare Advantage card. That's how that works. Again, don't confuse the parts with the plans. We talked about, part A, B, C, and D of Medicare, and we talked a little bit about the plans, plan A, F, G, and that gets a little confusing, but just remember the difference between Medicare, the parts of Medicare, and then the plans that are the Medicare supplements. So I'm going to give you guys a little example of what to expect in terms of what does Medicare going to cost when I turn 65, and let's assume that you're going to get A and B, and these numbers that I came up with are actually for the state of Illinois, and so this will give you a pretty good idea of what those costs are going to be. So again, Medicare Part A, usually no costs. Again, people that work 10 years 40 quarters paying their Medicare taxes don't have to worry about Medicare Part A premium. Part B, the minimum premium to $170.10 per month for 2022, but as you know, with those income levels, that can be higher. So looking at Medicare A and B, and I'm going to use just the basic, initial costs, based upon those income levels. So to have Medicare A and B, an individual would pay a little over $2,000, $2,041.20 just to have Medicare A and B. That's no supplement or anything like that yet, just for Medicare A and B. So let's say you have original Medicare. Now you want to add a Part D plan to it. So the average premium on a Part D plan is $33. So you're talking $396 a year that you'd be paying for a Part D plan. And that's just a premium. That does not include the cost of what your medications are at the pharmacy. So that's just, the cost of having a Part D policy. Because drug prices vary and can range from anywhere from nothing, people that take no medications, to well over 100, 200, 300 and up in terms of drug costs per month. So that's hard to estimate. But let's say you have original Medicare and that prescription drug plan. So you got a plan on $2,437.20, is what it's going to cost you to have original Medicare, and just to have that Part D plan, just to make sure you don't have that Part D penalty, if that makes sense. So that's just the basic cost there. Now let's take a look and add another thing onto this, and that's looking at that Medicare supplement. Pricing will vary based on insurance carriers, the type of policies, the age you are. So I looked at, male and female age 65, and I looked at a Plan G. Plan G, again, is one of the most popular plans out there in terms of a Medicare supplement plan. So the Plan G costs anywhere from $1,529 to $3,244. And look at that number. I mean, a Plan G is a Plan G. Doesn't matter what carrier you go to. A Plan G is a Plan G. So depending on how much you want to pay, do you want to be a person that pays $3,244 a year for a Plan G, or one that pays $1,529? But anyway, that just shows how wide that discrepancy is in terms of the premium for a Plan G plan in the state of Illinois. So most people want to, focus more on the lower end side. You always want to focus on a good carrier, but you also want to look at the pricing. You don't want to be overpaying for something that's a standardized benefit for a Medicare supplement plan. So an average Plan G premium for somebody 65 is about $2,383.50. And like I said, I looked at male, female, and just took an average. So when you take a look at that and you look at Part A, you look at the cost of Part B, you add that Part D, the drug benefit in there, and then you add that supplement plan. So now you can get to look at a total cost of around $4,800, or about $400 a month per person, just to have original Medicare, a Part D plan, and then a Medicare supplement plan. And you're probably looking at that. It's really not a bad price when you look at it, because we're all familiar with group health insurance and the premiums on that. And so in a lot of cases, Medicare can be quite a bit cheaper. And again, these are just average supplement prices based on, I did this for the state of Illinois within their website is where I pulled all this information from. So that just gives you a good example of what to expect, with today's numbers in terms of Medicare. Let's look at some of the resources, state and federal. So you always have your state insurance department. They always have information for beneficiaries on there. Your Social Security Administration, SSA.gov. your Centers for Medicaid and Medicare Services, CMS.gov. A lot of good information. Again, state insurance departments, a lot of good information available online. You know, two books. One of the books that you're going to get as you approach age 65 is Medicare and You book that Medicare is going to send out to you. More than happy to provide some PDF copies of this for anybody that wants to get a copy. But then the one on the right-hand side is the Choosing a Medigap policy for 2022. So that's dealing with a lot of specifics on the Medicare supplement side of it. But between those two resources right there, there's a lot of information in terms of Medicare and enrollment windows and you know, guides, you know, to help you with Medicare. So that is all I have this afternoon. I want to go through my questions real quick to make sure I didn't miss anything. If you have questions, please share them. I think if we can't get to them, we'll try to get those answered at a later time. But you know, one of the questions I had was, is it possible to have Medicare and other health insurance as well? And the answer is yes. You can have Part A, you can delay that Part B and still be on, you know, your health insurance if you're going to work past age 65. So you can have both. Again, you got certain situations, you know, are you going to contribute to a health savings account or anything like that that you may have to consider, you know, not going on to Medicare. But the one thing to remember is you cannot have a Med Sup and a Medicare Advantage plan at the same time. You should not have double coverage like that. So let's see, another question is, how do you choose a supplement plan? Do any government supplement plans cover extended care? We talked about that, the skilled nursing care, you know, the first 20 days is paid for, 80 through 100 has a copay, but then there's certain qualifications to get that skilled nursing care, which, you know, your 3 days that you have to be admitted into the hospital, and you got to be admitted. You can't be under observation. You have to have 3 days being admitted into the hospital for those skilled nursing care benefits to be payable. So, and I'm trying to see what else here. Is it, see if I got anything. Oh, you know, I want to go back to this, you know, why pay for a supplement insurance when you are on Medicare? And hopefully you guys understand that with that Part A deductible, $1,556, Part B, you know, Medicare covers 80%, but 20% is not covered. You know, those copays and different things like that, that's the reason you want to make sure you have some sort of a supplement to help cover those gaps. Otherwise, it's going to be out of your pocket. So that's all I got, Brennan.
Thank you so much, Rick. Really appreciate it. Ashley, did you have some closing comments before I speak?
No, not, I guess maybe one. There were some people who had some issues accessing the handout. So those people, I've already sent them that directly, but I can also send that handout in a follow-up email after the webinar. So if you couldn't access it, I'll make sure that you can. And again, we did record this session. It won't be available right after the webinar, but we hope to share that with you soon. It just needs to get approved beforehand. Thanks, Brennan, and thanks, Rick.
Yep, you're welcome.
So, thank you so much. And just closing comments here again. Thank you so much, Rick, for the time. A lot of really good information. I think definitely the takeaways are that, you know, everyone's situation is unique, especially when it comes to that Medicare Part D. It's very customizable. We encourage you to, you know, reach out to myself. I can hook you up with Curtis, who is qualified to run quotes for you and look at your individual situation. I'd be happy to connect with you, with him on the side if you would like. Also reminding you that, you know, we here at Mueller Financial Services, we are very financial planning oriented. Again, we do cover and look at how Medicare is going to impact your plan. Even something like Rick mentioned, like the IRMA limits or the income related monthly adjustment amounts, we are taking a look at those to try to keep you in those lower brackets. So you're going to take money from, you know, your after-tax accounts, or you're going to take money from your IRAs. It's all about making sure that the government only sees so much income from you, and we try to keep you in those lower limits. So we have a deep team of professionals here. We really do appreciate your time. Sorry we went over a few minutes, but hopefully you found this information valuable. My contact information is listed there, and we encourage you all to reach out should there be any follow-up questions. So thank you so much again to Rick and to Curtis, and we appreciate your time.
Thank you.